all of my advice, as has always been the case for the last 2.5 years, and the same with my colleagues in the states and territories, is based on the best science and the best medical advice that we have at the time. There are a range of things we look at to give that advice. We know how Omicron works. We've been through 2 waves already. This is the 3rd one. We can look back to January and give us some sense about what that does in terms of hospitalisations, ICU admissions and the like. We know from other countries, for example, the UK has gone through a BA4 and BA5 surge in recent times, in South Africa and other countries, and seen how that has worked. And we know the real data, which we've talked about already today, that we are in the 5,000s in terms of hospitalisations for the first time since around early February. So those are things. We also have forecasting, which we've had from our modellers that have provided that weekly for many, many weeks. I think we're up to report 151 now, and so we do look at that every week. But these are predictions. To give a number, an actual number to that would be false, I think, because it's a prediction. We don't know exactly what it will be. What we do know, and this is where that forecasting leads, and what I shared with ministers over the last few days, is that we can predict reasonably well up to 4 weeks from now, and in every state and territory the number of cases, according to those predictions, are continuing to rise. So we're at the start of this wave, not the end. We know that that is associated with hospitalisations, but what happens in the future really very much depends on what we do today and what we've done in the last 2 weeks. The increase in vaccination, the increase in the protections in aged care, in particular around treatments and the vaccination, the increase in mask use, the increase in choices that people are making. Not to say this is an individual responsibility, but it is a combined community effort that we need to put in place for the next few weeks, and that will make a big difference in that number, whatever we get to.